Hello, my name's Ben, and I'm a Physician Associate, or PA, at University Hospitals Dorset. In the very likely event that you don't know what I look like, this is me on the right. What's a Physician Associate, I might hear some of you call? Don't worry, I'm quite used to it. Physician Associates are generalist healthcare practitioners who comprise members of medical teams across primary and secondary settings within the UK, assisting in both the diagnosis and management of patients from a background of life sciences related undergrad education prior to a placement heavy postgrad course, and then oftentimes a preceptorship once qualified. This is a relatively new and quickly evolving role, the total numbers of qualified PAs in work having risen from around 600 in 2015 to 2,800 in 2021, with the NHS planning to have welcomed nearly 6,000 into practice by the end of 23. The role posited to be an inclusive and diverse one in its infancy, opening new doors to educated people seeking careers in healthcare, and as it grows, so should the importance of adequate representation, whilst it's also prudent that the profession does not become a closed shop to those and only those who can afford the considerable costs of training, for which typically only half the necessary tuition loan can be received. There's fairly extensive research into the importance of diversity in medicine and nursing courses, some of which has led to huge and largely successful initiatives for greater representation. This hadn't been explored among PA students beforehand, so I thought I'd take a look at it. So, socio-economic representation is important to patient care in a few ways. Firstly, greater financial barriers to healthcare schools directly limits the talent pools among applicants available to them. Influxes will be smaller and therefore skewed further toward privilege than to aptitude. Greater diversity also means patients feel more represented. This is particularly important for minority groups. There's also some evidence that healthcare applicants from more deprived backgrounds are more likely to go and work in deprived areas where healthcare may be underserved once qualified. I set out to explore how PAs were funding their studies, their sentiments around doing so, and what their personal circumstances were like. For example, level of education, number of dependents, travel expenditures, whether people were doubling up on rent to cut travel, etc. I did this using a free online questionnaire and then used mixed methods analyses, including a thematic analysis, to make sense of it all. All respondents included were undergoing PA studies at the time of the survey, and those on undergrad courses were not included. Between June and November of 2021, data from 189 valid respondents was collected, a huge sample size which I'm very proud of, encompassing somewhere between 15 and 20% of all PA students at that time. The demographic data collected didn't differ greatly to that of the most recent qualified PA census. The majority of respondents identified as female and white British. PA studies were funded in numerous ways, including via healthcare grants, 76%, government loans, 68%, assistance from family, 63%, and self-funding, 61%. A whopping 95% agreed that they worried about their finances, with 83% also agreeing this had a negative overall impact on their studies. Over half undertook paid work in addition to their full-time studies, with 71% of those disagreeing they would continue to do so were they in receipt of greater funding. Some, 16.5%, had others who depended on them financially, with 77% of those disagreeing that they were well supported in caring for their dependents. During thematic analysis of free text questionnaire responses, four major themes were generated. Firstly, PA studies incurs excessive and oftentimes unexpected cost, with inadequate funding and increasing exam costs common points of contention. Secondly, despite its frequent necessity, additional paid work hinders time for studying, which can become cyclical if requirements are not met. Thirdly, that the finances involved affect mental health and well-being negatively, causing people to feel that they're surviving rather than thriving. And finally, varied concerns about accessibility, class issues, and elitism becoming more prominent among PA courses. I've picked one quote from the data for each of these themes, and you'll see how they intersect. The money given by Student Finance England is not sufficient for student fees. Therefore, most of the funding from Health Education England is paid toward this. This leads to financial difficulties when paying for accommodation and travelling to placement. I am trying to keep a part-time job going at the weekends, but it caused me more stress and workload as the course is intense. I worry I'll need to quit my job to be able to have enough time for study, but then worry I won't have enough money to keep funding expenses. I worked 2 jobs prior to starting the master's course. I saved 70% of my wages, which I thought was enough. I have my placement at a hospital that's a 19-mile round trip from my house. If I were aware of the additional cost involved, I would have applied for medicine, as I might have been in a better situation and less stressed about finances. I think more people would apply for this programme if there were more opportunities to obtain grants, scholarships, funding, etc. A government scheme needs to be offered to help students pay for their education. At the moment, I don't feel the government is doing enough. In conclusion, almost all PA students were worried about their finances, and the vast majority agreed that this hindered their studies. Respondents often described the costs associated with PA studies as burdensome or even prohibitive in other aspects of their lives, such as caring for dependents, those with dependents describing being disproportionately affected by unforeseen expenditures, such as increasing exam fees. Unfunded tuition and commuting expenses featured prominently as financial stressors, compounding mental health issues and causing concerns about the future of the role. Where the physician associate profession occupies a space with a relatively blank slate, this gives us the opportunity to set precedents in order to ensure that accessibility issues, which have been historically problematic in healthcare, do not simply become accepted as part of the culture. Suggestions that could be made off the back of this research to maximise accessibility include increasing the available SLC loan to cover both years' tuition rather than just the one. Accommodation could be subsidised to decrease the burden of commuting and rent, or the introduction of bursaries considered for those with dependents to look after. Ensuring the door is kept open to those from all walks of life can only achieve broader horizons for this new and exciting profession. We mustn't deny patients the right to the most talented professionals at their bedsides simply because they couldn't afford to make it there. Thank you so much for listening. I'm still working on the paper, but please come and check out my poster if you haven't done so already. And you can email me at ben.wilkinson@uhd.nhs.uk with any further questions you might have. Though I'm far from an influencer, you're more than welcome to also follow me on Twitter if you'd like, my handle on screen. I really hope you've enjoyed listening, or if not, that at least you've learned something, even if that's what a physician associate is. Thanks again and enjoy the rest of the conference.